Hello, everyone. My name is Brittany Winans, and in this presentation, we will be examining New York State's involuntary hospitalization policy under the mental hygiene law. The New York State mental hygiene law permits the involuntary commitment of individuals experiencing mental illness when they are deemed a significant risk to themselves or others. We will be analyzing both its intended and unintended consequences, in addition to exploring ethical issues such as autonomy and dignity. It considers the policy's economic, social, and public health implications by evaluating the effectiveness and fairness of the law. The analysis aims to inform future policymaking and mental health practices. Ethical concerns. This policy raises significant ethical concerns regarding autonomy, dignity, and the right to make decisions about one's own care. Involuntary hospitalization may cause more harm than benefit, as demonstrated by higher suicide rates following discharge and the potential for lasting psychological trauma. It can undermine self-determination and damage therapeutic relationships, especially when refusal of treatment is automatically interpreted as a symptom of illness rather than an informed choice. Many individuals report a profound loss of power, self-respect, and trust in the mental health system after involuntary treatment. Manifest goals. The manifest goals of involuntary hospitalization include providing rapid intervention when an individual with mental illness poses a serious risk of harm to themselves or others. This determination is ideally based on credible evidence, such as explicit threats, attempts at suicide, or self-harm, or behaviors that cause reasonable fear in others. Timely intervention is intended to reduce negative outcomes through effective crisis management, potentially preventing tragedies and stabilizing acute symptoms before they escalate. Latent goals. These goals may include removing individuals perceived as dangerous, those struggling with substance use, or homeless persons from public spaces by categorizing them as unable to care for themselves or as threats to society. While these aims may be framed as public safety measures, they risk prioritizing social order over individual rights and can contribute to the stigmatization of mental illness. Moreover, involuntary hospitalization of those considered high risk may inadvertently increase incidents of suicide or violence after discharge, highlighting the need for a more nuanced approach. These competing goals can create conflicts between the imperative right to protect public safety and the obligation to respect individual rights. Such tensions raise complex ethical and legal concerns, requiring careful consideration of due process, informed consent, and the potential for misuse of psychiatric authority. Intended effects. This policy enables swift intervention to prevent harm or harm to others. It establishes a framework for ongoing mental health care. It reduces future crisis risk and supports long-term recovery. The unintended effects. It raises ethical concerns about autonomy, dignity, and self-determination, increases suicide risk after discharge, and disproportionately affects minorities, particularly Black men and those with severe mental illness. Economic impact. New York State's mental hygiene law is funded by taxpayers and administered by public agencies. Expanding the criteria for involuntary hospitalization, particularly for homeless individuals, will likely increase costs and may result in higher premiums or taxes for the general public. The policy primarily affects those who are hospitalized, often resulting in job loss, ongoing financial hardship, and difficulties reintegrating into the community. While Medicare and other insurance programs cover some of the expenses, patients are still responsible for a portion of the costs, which can be substantial. Inpatient care is significantly more expensive than outpatient services. In contrast, community-based early intervention and support programs are more cost-effective, improve long-term outcomes, and reduce the likelihood of repeated crises. The mental hygiene law is not cost-effective. Inpatient programs are significantly more expensive than outpatient services. Some inpatient costs may include therapy, medications, cost of clinical staff, rooms and housing, support staff, food, security, activities, and custodial services. The current policy in 2025, Governor Hochul and the Trump administration backed the use of mental hygiene laws to address homelessness. Hochul's budget amendment broadens involuntary commitment to include mentally ill individuals at risk due to instability or refusal to secure basic needs like food, shelter, or safety. Research needs. Current policy is influenced more by tradition and institutional inertia than contemporary evidence. The limited availability of rigorous experimental research raises important questions about the long-term effectiveness and justification for involuntary hospitalization. Evidence-based reforms, increased transparency, and ongoing evaluation are necessary to ensure that policy serves individual and societal interests. Final analysis. Involuntary hospitalization enables rapid intervention for individuals at immediate risk, but it also may increase harm as suicide rates rise significantly after civil commitment. To address these challenges, additional research, enhanced professional training, and the implementation of early intervention strategies are necessary. Developing comprehensive community-based systems of care can help balance the need for safety with respect for individual rights, ultimately leading to better outcomes for all stakeholders.